Hello, I'm Greg Hartwell. I'm an assistant professor at LSHTM, the London School of Hygiene and Tropical Medicine. I'm going to give an overview of our School for Public Health research project, which has been exploring secondary school support for the mental health of students in the COVID-19 era. And a big thank you, first of all, to my colleagues Karen Locke, Matt Egan, and particularly Rhiannon Barker for all their input and efforts on this study. A bit of background first. Two very important things we already knew before COVID arrived were that schools play a crucial role in the mental health of children and young people, even sometimes acting as a form of sanctuary for some of the most vulnerable students. We also knew that the mental health of children and young people was already in decline before the pandemic, with increasing proportions of teenagers experiencing distress or anxiety or engaging in self-harm. Since 2020, we've of course then had the impact of COVID layered on top of that, and it's a complex picture in terms of the pandemic's impacts, but what's clear is that lockdowns and school closures were very challenging for a lot of children and young people, and some of the many negative mental health impacts are likely to have been experienced most acutely by those more vulnerable students I mentioned a moment ago. So overall, a challenge that's often been discussed in relation to the school sector has been how to catch up the attainment gap, as it's been called, which essentially means the academic ground that some people feel students need to make up due to periods of school closures. But there's a corresponding challenge, which is how to make sure any efforts to deal with the attainment gap do not end up exacerbating the mental health damage that we know the pandemic has had on many children and young people. Our aim, therefore, in this study was to help identify support which may facilitate the building of a positive secondary school culture and protect student mental health, particularly in the wake of school closures from COVID-19. And the word support there in the first line is particularly important. We wanted to know what support were schools providing to students in this area, but also what support did schools themselves feel they needed in order to do this better. So how did we go about it? Our research began with a scoping phase that involved rapidly surveying the literature around school culture and mental health and the impact of the pandemic on children and young people. We also had some very valuable patient and public input support from Young Health Watch Central West London and held a series of discussions with a range of stakeholders from academia, the civil service and voluntary organisations. This led on to our main fieldwork phase, which involved qualitative research in two very different London school case study sites. So as you can see here, case study site A was oversubscribed with a reputation as being a strongly academic school and amongst some of the parents as a good alternative to private education. The school catchment was very diverse, covering wards in the highest and lowest income quartiles in England. Case study B, on the other hand, was a faith school located in a more uniformly deprived catchment area with a significant intake of refugee and migrant children. And the school prided themselves on the pastoral and practical support offered to young people from a variety of sometimes very traumatized backgrounds. A little bit more detail on how the fieldwork actually broke down. You can see here that the project was bookended by discussions with stakeholders, both to scope the work and then to discuss and help contextualize our findings. But the main fieldwork involved a series of in-depth interviews with parents, teachers, welfare staff and school leadership, and a number of focus groups across the two school sites. In total, we had 17 in-depth interviewees and 22 student focus group participants who ranged from year 7 to year 11. Documentary analysis was also conducted of school policies, Ofsted inspection reports, and other relevant documents in the public domain. In terms of our findings, essentially we identified a complex mix of factors relating to school culture which appeared to influence student mental health and which in the current context might therefore have potential to be built on to support outcomes in this area further. These kinds of key areas included tolerance of diversity, shared beliefs and values, safety and discipline, school leadership structures, physical environments, and processes for offering mental health interventions. To give some more concrete examples, firstly, the governance structure of a school seemed to be crucial, in particular the way the senior team communicated with and supported parents and school staff, both teaching and non-teaching staff, appeared to have a tangible impact on school culture and on whether student mental health was given as much focus as addressing the attainment gap that I mentioned earlier. We also identified considerable differences in mental health provision, particularly in relation to lower levels of need which may have increased due to the pandemic but which are not covered by statutory requirements. And another thing that came out very clearly was the interrelationship of staff and student mental health, and the sense that staff are simply not getting the support they need to look after themselves and therefore to look after children and young people as effectively as they would like to. In terms of mental health provision, both case study schools were currently deploying an impressive range of support interventions for students deemed to be in need of mental health or well-being support, including informal sessions with teaching assistants, formal counselling and resilience support. Case study B had a particularly wide range of tailored support which was based explicitly around the Thrive conceptual framework, which facilitates a multi-agency approach to support. For the most severe cases, clear processes were followed, often built on statutory guidance in terms of safeguarding and referral to child and adolescent mental health services. Current levels of underfunding and system pressures meant these processes were often reported by staff and parents to be slow, clunky, and lacking flexibility though. Our initial findings from our literature review and stakeholder discussions are available in the Journal of Epidemiology and Community Health, and we have a further paper of our main fieldwork findings under review with another journal at the moment. We've published a blog on the School for Public Health Research website about experiences of conducting this fieldwork during a pandemic, particularly the challenges of recruiting schools to take part in the midst of nationwide school closures. And we've also provided our findings, first of all, to the schools involved in the form of detailed, individualised reports. Finally, we believe our work has relevance for current policy, which we've drawn out at more length in our first published paper. Essentially, there appeared to be those real gaps, as I mentioned, around support for staff mental health and well-being, which could require more sector-wide consideration. In addition, the need for better identification of low-level mental health need came through strongly from our fieldwork, which suggests there could be scope for more screening of student well-being in this area. And further promotion of whole school initiatives and positive whole school cultures that filter down from the very top appeared to be vital to improving student mental health as the school sector continues to evolve and build resilience following the impact of COVID lockdowns. Similarly, mental health provision clearly varied significantly between schools, particularly in relation to lower levels of need, as I mentioned, which are not covered by statutory requirements. Our results suggest that the type of well-being provision within a school may in part be dependent on the individual motivation of committed teachers. Case study B, for instance, was an example of a school where an impressively wide range of provision was in place, much of it apparently enabled thanks to the head of safeguarding's personal motivation, strong partnership working, and ability to call in favours from external parties. A challenge for schools thus appears to be to find a way to provide consistent, evidence-based provision across the board from within a constrained resource base. Yet the fact that so many different forms of interventions are used across the sector nationally means that data offering clear evidence of efficacy can be hard to find. A 2017 government green paper set out an ambition now being enacted to strengthen mental health provision in schools, with plans to have a designated mental health lead in every school by 2025. The education and health sectors will no doubt be keenly interested to see how this and the subsequent pledge of £8 million in response to concerns about the impact of lockdowns on students will impact on mental health outcomes in children and young people. A valid concern may be that in the huge raft of possible options schools have to support children and young people's well-being, too much is left to chance. Care is therefore needed to ensure that uncertainties around the availability of motivated and skilled teachers do not risk further exacerbating existing inequalities in this area. Also pertinent is the fact that a large number of staff and parents in our study mentioned that financial constraints and pressures on the wider health and social care system impacted on the ability of schools to respond to individuals in need. So that's our study in a bit of a nutshell, but I hope you found this helpful. If anyone does have questions or reflections, we'd love to hear from you. Our email addresses are here again. Thank you very much.